The national strategy for the coronavirus pandemic in Nigeria remains early detection of cases, prompt isolation and treatment, contact tracing, and more testing. According to the NCDC, speculations, especially about the increasing number of cases, dominated rumors this week. So how can we get past these challenges and bring the numbers down? We have Dr. Omede Ogu, a public health and project management expert. He joins us from Abuja studios. Thank you for joining us on the program. I'd like to begin with what we heard from the PTF yesterday, that the greatest challenge to the fight against the pandemic is a failure by many Nigerians to believe in the existence of COVID-19. Do you think that this is a challenge the country can get past?
Yes, thank you very much and for welcoming me to this program. It is a challenge that government can get over it, because for any type of disease in the context of public health, awareness creation and continuous awareness creation is key. And every opportunity that is available to create awareness, either using big or small events, is a welcome idea to do.
How would you say that things have panned out since the first case in February, almost 6 months now? Do we have a societal approach to the control of the coronavirus spread?
Yes. Since the first index case was, reported till now, like you said, 6 months has spanned. And depending on the national strategy and the length of the plan they have put in place, either on the interim basis or as a standby plan, ideally there should be what we call, for example, if it's a one-year plan, there's what we call a midterm review. And a midterm review is a technical strategy that looks for specific indicators or objectively verifiable indicators that tells on how far the government approach and plan put in place over half of that period has been effectively done. Besides that, the indices that comes out of this kind of report will also provide solution going forward. So looking at the plan that NCDC has, if it's a one-year plan for the target of 2 million people, for example, this is 6 months. The midterm report is long overdue, and effort should be put in place to produce that report so that they can tentatively tell us how far the journey has been.
Indeed, and we're also nearing the extension of the second phase of the lockdown ease. The review that the Presidential Task Force gave us the last time, I think that would expire sometime next week. And so in reviewing the modifications of the PTF in the last lockdown ease extension since the 1st of July, would you say that we've had, and this is in the case of domestic flights resumption, have we had a safe reopening of domestic flight operations?
Yes. Again, I don't know if the review mechanisms of government are all made public, but from the perspective of the PTF, in terms of airport reopening and then traveling by air, so far so good. From random reports coming from different medium, there had been successful travel through the air in all the phases of reopening. But that is not enough to say programmatically or in the context of public health that it has been successful. For reopening, there are some measures that are put in place by government, and those measures, most times to tell tentatively, should be measurable and should be accounted for. And until that is done, one cannot just assume that the reopening is very, very successful. Because one thing is key and it's obvious in the reopening of airport. Of all the measures that are put in place, there's no room for testing, and that leaves room for a lot of questions.
Should those measures also apply? Because we remember the position the government gave with students writing exams to wait until it's absolutely safe to do so.
Sorry, can you come again? I didn't get that.
Talking about the federal government's position on students writing their exams, if you remember, during the modification, they said it was okay, and later they went back on that. So in reviewing for the next, perhaps, lockdown ease measure, do you think that should be reviewed?
Well, in answering that question, what I think we should look at is some of the medium through which this COVID-19 can be transmitted. For example, if students resume, the student will eat food. What measure has government put in place in terms of food hygiene in the context of respiratory and cough etiquette or hygiene? Has government put anything in place? Because in the process of feeding, through some of the instruments that will be used and some of the facilities that will be used, there could be an increased possibility of infection. That aside, in school, there's also possibility of increased interpersonal contact. And there's what we call surface contact hygiene, like, putting on the electric switch for students that are in boarding school, the tables they use, the doorknobs, and some of the school facility that exposes them to contact. What measures have been put in place to promote awareness in these areas? Until some of these things are done, and then physical social distancing is also key. How is that going to be curtailed? Learning from experience in some countries that have called for resumption of schools, they were forced again to close down very quickly within a space of 4 to 6 weeks. So learning from that experience, what were the biggest challenge that they were encountered? Most of the challenges they encountered has to do with surface contact hygiene, and how prepared at the school level and at the national level to roll down or roll in guidelines that could mitigate or reduce some of the possibilities of spread of the infection. Until this is done, in my opinion, it is a very, very difficult question to answer.
All right.
Because imagine what adults pass through when they are infected. Imagine if that should happen to children.
We definitely don't want that to happen.
Very debilitating.
All right. We'd like to thank you so much, Dr. Omede Ogu, Public Health and Project Management Expert. Thank you for joining us on the program.
Thank you, Millicent.